Good morning and welcome. My name is Miriam Singer, and I have the pleasure and privilege of serving as President and CEO of Jewish Community Services of South Florida. Today, we celebrate the accomplishments in the service to community of our 211 team at Jewish Community Services. We provide 24/7, 365 days a year services in all languages, primarily in English, Spanish, and Haitian Creole. We provide information and referral services and mental health, crisis response, and suicide prevention services to our entire community. It is really a pleasure today to provide this panel of experts and treasured partners to Jewish Community Services that do the work that is so important in strengthening the safety net of services to provide for those that are frail and in need of support, either transitionally or in the long term, for the residents of Miami-Dade and Monroe counties. And with me today, the distinguished members of the panel are Paco Velez, who is the CEO of Feeding South Florida and has provided significant support in response to food insecurity throughout our community. Welcome, Paco.
Thank you very much for having us.
And also here is Carrie Ann, President and CEO of the YWCA of South Florida. Carrie Ann has over 25 years of public sector experience and is an amazing leader and activist on behalf of families throughout the community, an inclusive and diverse and welcoming organization. Welcome, Carrie Ann.
Thank you, my friend.
And then we have to my left is Peter Arroyo Usted, who is the CEO and president of Catholic Charities, also a very valued partner of Jewish Community Services on an ongoing basis for many years and most significant work in support of Surfside Response. Thank you for being with us, Peter.
Pleasure.
And with us also is Susan Racher, who is the volunteer lay leader community action agent for NAMI of South Florida. Welcome, Susan. Susan and I just returned from a few days in Tallahassee, always advocating for mental health services and mental health education for those in need in our community. So nice to have you. And it is also a pleasure to have Richard Schutz, our director of our 211 program. Richard is involved at the national, state, and local levels in terms of advocacy, learning, and strengthening our net of 211 services. It's wonderful to have you join us.
Thank you. Pleasure to be here.
Great. And so we also have Audrey Arana, who is the Deputy Director of Miami Homes for All. And we're so delighted to have you here because housing and access to housing is such an important and critical issue that affects every area of service in the community we serve. So welcome. It's great to have you here. And so without further ado, I am going to dive into a series of questions. And I would like to see if we can start with Paco and the responses and go around the table. Would you please share the message of what you would like our community to know about Feeding South Florida and its amazing work on behalf of our community?
Sure. So a couple of things. First and foremost, we provide access to food for families who don't have access to food. But on top of that, what folks may not know about Feeding South Florida, we also provide nutrition education, other life skills, bring in folks to do financial literacy, computer literacy, resume interview skills, things like that. And we also take it a step further and use our resources, our warehouse, our kitchen, and soon our fleet to prepare folks for the workforce. So we provide workforce training programs in warehousing inventory, in food service management, and pretty soon we're going to go to CDLA, CDLB training program to get people more marketable in the workforce and put them in jobs that can provide them a living wage and help them on the road to independence.
That is remarkable. You're beginning to work on wraparound services in addition to food security. Thank you so much. Yeah.
So at YWCA, I think people don't recognize that YWCA is a social justice organization at its birth, at its core. And everything we do is specifically to address an inequity that exists, especially for women of color in South Florida. So everything from early education to school age education to economic prosperity, many of the programs that Paco mentioned, financial literacy, upskilling, job training, wraparound services. But one of the programs that we're really very proud of that very few people know about is that we actually have what we call human rights programs in 5 courthouses in Miami-Dade County and 1 in Broward, where we have a drop-in childcare center. It was mainly started when we wanted a space that women who needed to have injunctions for domestic violence cases didn't have to worry about, 1, their children being re-traumatized in the courtroom, and 2, childcare in order to be able to protect and support themselves, which we know is a major barrier for women to be able to leave aggressors. So we're very proud of those programs being offered in the courthouses and invite folks who are looking to mobilize their lives in whatever way they dream about to be supported by YWCA.
Very impactful work. Thank you so much. Peter, please.
Sure, thank you. Catholic Charities of the Archdiocese of Miami, we're going to be celebrating our 92nd year providing services, and very comprehensive. I would say we go from conception to end of life with counseling, alcohol and drug, substance abuse, both inpatient, outpatient, immigration, refugees, services to the elderly, early Head Start and Head Start programs. And we do it all, although we're faith-based, regardless of race, creed, or religion, or sexual identity. So I think that's important to know. And probably the other thing that maybe some don't realize is the amount of work we do regarding advocacy as well. With our campaign for human development, we support organizations such as PACT and BOLD that are really grassroots driven. And we do a lot of disaster relief work, both locally, statewide, nationally, and very involved. Since we are the gateway to the Caribbean, we're very involved in the Bahamas and in Haiti, and in Cuba, and ongoing throughout the year.
It's impactful work, and I so appreciate the partnership. Susan, please share.
I'm volunteer board president of NAMI Miami-Dade. We're the National Alliance on Mental Illness, affiliate of the largest mental health organization in the country. We cover Miami-Dade, and now we have adopted the Keys as well. What is unique about NAMI is that our programs are peer-to-peer programs. The peer model was actually invented by NAMI many years ago. What that means is that people with lived experience like myself, I'm a family member of a young man who is recovered from a serious mental illness. Family members, as well as individuals like my son, are trained according to national standards, their evidence-based standards and programs to help others with mental health support and education. In addition, we have taken on a very robust literacy program. Mental health literacy is really important. It's important for families, it's important for employers, it's important for teachers and staff members to understand what are the warning signs of mental illness. What do you do when you see these warning signs? How do you communicate with an individual who's going through a mental health challenge? And where do you get resources in our community? Because there are resources, the system can appear to be intimidating and onerous, and navigating those resources is really important. We focus on families, we focus on youth. We have a program in the Miami-Dade Public Schools for middle school and high school students to help them, help themselves, as well as their friends. And everything we do is free of charge, no income asked, no residency status asked. Everything we do has absolutely no barriers to access. We just want to help the community because we've walked in those shoes and we know how hard it is to deal with mental health challenges.
Again, good morning. 211 Miami is a program of Jewish community services where we aim to help out everyone in the community in Miami-Dade and Monroe, regardless of where you come from, your any type of need that you might have. We're that glue that can actually connect this entire table together. You might have family members or even yourself needing help with food, needing help with your children, programs, you name it. Calling 211 is that number to get you connected to any social service that you might need within your community, whether you're all the way down in Monroe, Aventura, Homestead, Alapata, Little Haiti, no matter where you're at, we make those connections. And it's not only providing information, because Google can do that, but sometimes you go Google something, you're not getting the most up-to-date information. And what about that humanistic, that human touch? People are going through crisis, needing things. Being able to actually speak to someone that's fully trained to be empathetic, to be there in that moment of crisis for social services in the community to ensure that you get connected to what you are eligible for in your community. So a lot of people are unaware that 211 is a number that exists. We are all familiar with 911. A lot of people are familiar with 311, but 211 is that number, and we answer in English, Spanish, Haitian Creole, and any other language that you might feel comfortable with through an interpreter. We're certified through various national accredited bodies, and we're one of the largest metropolitan 211s in the nation. And we have an extraordinary dedicated team, a lot of them tuning in today, but again, they really make this work happen for the betterment of all of our community. So yeah, 211, if you're not familiar with it, save it in your phone. And we'll talk a little bit more about it through our panel today.
Thank you. Audrey, please.
Good morning, everyone. And so Miami Homes for All, we're an advocacy organization focusing on increasing affordable housing and ending homelessness here in Miami-Dade County. And so we backbone the Greater Miami Housing Alliance, which has over 115 active members representing service providers, advocacy groups, mental health organizations, and other entities that address affordable housing in general. And something that not many people may know about is that we have HOMI, Helping Our Miami-Dade Youth, and in that we have our Youth Voice Action Council. And that initiative is all about ending youth homelessness in Miami-Dade County. We know that many young people, because of the rising costs, because of whatever issues may happen within the household, a lot of our young people, there are over 6,000 students right now in Miami-Dade County Public Schools are experiencing housing instability. And we work very closely with 211 to try to find out what are the root causes and figure out ways to, one, implement some advocacy strategies, as well as how do we improve or address some of the services that we have in Miami-Dade County to better support our young people. And we provide youth with leadership training, advocacy opportunities. And so our Youth Voice Action Council, they're go-getters, they're the ones that inform what our policy priorities are. And it's just a really fun time working with them.
Wow, it's really amazing to engage our youth in finding solutions to the complex challenges and problems in our community. So that leads me to the next question, which is we are a community that has strength in responding to the day-to-day, but also renewed strength in responding to crisis situations. We've had the pandemic, we've had the tragic Surfside collapse, we've had a Hurricane Ian on the West Coast that has affected us as well. We've had fires in Miami Gardens recently. Please share what are those unique resources that you have provided over the last 3 years and how that has changed your organization and your service delivery program for our community.
Are we roundtabling again?
Sure. So you're absolutely right. We as a community in South Florida, we do experience quite a bit of emergency response, whether it's hurricanes here, starting with Irma 2017 and the government shutdown, Michael, then the Panhandle, the pandemic, of course, and then Ian and Nicole as they hit our coastlines. And so what we do is we pre-spawn by ensuring sites, whether it's evacuation centers or our partner agencies or anyone else has the food and water, MREs or meals ready to eat in order to serve the families that are going to evacuate, their houses. or in response to government shutdown, we go to the Coast Guard sites, we go to the Federal Bureau of Prisons, we go to the U.S. Attorney's Office, all those who are affected by a government shutdown. Same thing with the pandemic, we launched and we increased our distribution threefold to the point where we distributed 183 million pounds of food in just a 12-month period. Ian, we sent a truckload every day to Naples and Fort Myers. And we lent them our generator so they could power their food bank. We provided prepared meals, excuse me, and we lent them our staff and equipment. So we do that. We did that at Panhandle after Michael. We do that in Naples. So we're really there to support our network of food banks, but we're also, more importantly, here to support the families in South Florida before a disaster or an emergency or a crisis, and absolutely after. And what we let them know is that we've been here, not quite as long as Captain Tony's, but we've been here for over 42 years, and we're going to continue to be here for our families, not just during an emergency, but even the crisis that we have at home.
Wow, what a powerful impact. And Feeding South Florida has also been an amazing partner, and I thank you to JCS in our community food distributions throughout the pandemic and because of the need following the pandemic, even up until today. So thank you so much for your support. Great.
And I mean, along those lines, one of the best examples of response was our partnership with JCS and food distribution. I think what we recognized in the last 5 years at YWCA, maybe before that, but I've been there 5 years. We've always made our home in the community. So our YWCA facilities sit in the neighborhoods and communities that we dedicate ourselves to because of the need that we know is in our region. That allows us to do place-based work in a very different way in times of crisis. So it gives us a space to be a pin drop that gets to be a distribution point for other partners. So we've recognized over time that what's become one of our greatest assets is this opportunity to be this distribution point. And so we've grown a new muscle of responding however is necessary. In hurricanes, we've done FEMA applications with legal services. We've hosted music demonstrations just to calm people's nerves, right? We've distributed food. We also responded by creating a women's success fund to be able to remove barriers that were just immediate barriers, losing your job or trying to get back into the workforce, just making sure you still have somewhere to stay while you upskill. Things that really derail our ALICE population, just that one emergency that they need cleared so they can stay the course. That was a unique response. And we also, after the pandemic or during the pandemic, created these learning hubs. Kids were not in school, but their parents need to go to work. And generally, multi-generations were taking care of them during that time who couldn't help them with the technology, didn't have the technology, needed the additional support and care. So we were able to create these learning pods to be able to support them with other partners like you, Allegheny Franciscan Ministries, and other partners that really just help us to be immediate place-based response based on what we were hearing from our community, what they needed, and turning over our space to allow that to happen.
Thank you.
No, I think a sign of a vibrant agency is that we've got to really be able to adapt to what the needs of the community are. And I think you've heard it from them already. You know, certainly in the pandemic, we have always, through some sister agencies, done a lot of food outreach, but they've been the ones that have really done it, and we've kind of been, you know, a resource for them. We certainly had to get much more involved with that, with Feeding South Florida. Our congregate meal program went from 12, 13 sites where people would gather, the elderly would gather socially. We had to overnight begin to deliver over 1,200 meals daily to this population. At Surfside, from day one, we were there. The local Catholic Church became a major staging center, and but we can't do it all, and Jewish Community Services is very involved, and we've kind of passed the torch over to you, and you're doing a great job. But I think what I want to focus on a little bit is I guess you can call it a crisis, but the over past year and a half, we've had over 200,000 migrants coming into just the Miami area alone, Miami-Broward County. And we are the number one, for those being processed at the border, and 75%, I'm going to use this 75% a lot, 75% are processed. And then they come with a case number, and their number one destination is Florida. 75% choose Florida. Of that 75%, 75% of them choose Miami. And so, we are the number one destination. And whether it's the Cubans or the Venezuelans or those from Nicaragua or Haitians, we have a tremendously resilient community. And so how do we take them in? Because everyone's been through this. So we're willing to be sponsors, willing to open up the homes, regardless of the tremendous housing challenges that we have. And so it speaks so much about the resiliency and the vibrancy of the city that we live and work in. In that time, the real tough cases, are the ones who show up literally at our doors, and could be a mother with 3 children, and they have absolutely nowhere to go. And those are the real tough cases that we've had to deal with over the past year. I mean, literally, well over $500,000 working with different hotels, motels, and stories that never get told, trying to bridge a gap until we can figure out, maybe Miami is not the best. Maybe they need to get on a plane and head to Chicago or wherever. But so those challenges will remain. And, I want to point out also within that, many people don't know, but we have the longest running unaccompanied minor facility in the country. It started in 1960 with Operation Better Than Pond, where 15,000 Cuban children came in. And to this day, that is still running. So, and we have within the state, the only unaccompanied refugee minor foster care program as well. So that kind of divvies back off of everything else that we do with the migrants.
Thank you for your beautiful work. Both Carrie Ann and Peter, you have shared the beauty of the partnerships and sort of that carefully hewn mosaic of services that are provided by all the organizations. At 211 Miami, we have close to 3,000 resources in this community that are available to support individuals in Dade and Monroe County. And the ability for our agencies, even just at this table, to come together and strengthen that safety net is remarkable. I'm reminded of a story, Peter. Our chief programs officer received a call at 4:45 on Friday. Traditionally, these calls come in at that time from a local law enforcement agency saying that they found a family of 5 from Venezuela walking on the Palmetto without any documents, without any resources, and of course came in help. And so, yes, JCS sprang to action in partnership with Catholic Charities, and it was almost, biblical, the way that your team came to us and said, yes, we can help. The family was instantly picked up, transported to a hotel for 6 days. We provided food support, thanks to Feeding South Florida, some gift cards and some community care coordination. And then after the 6 days, Catholic Charities had a shelter for the family and was able to take on the coordination. So thank you so much for the beautiful work that you do in community building. And I've learned so much about place-based work, a new term of art for the amazing work that you do. Thank you so much. Susan, would you like to share on this
Sure.
topic?
Well, the beauty of all of us around this table is that we're all focused on the whole person and the needs of that whole person, nutrition, housing, and mental wellness. And the last few years has the pandemic and the other thing, Surfside and a number of other issues has created an unprecedented level of mental unwellness, particularly among youth. And, you know, the CDC, the Surgeon General, the American Academy of Pediatrics, even ARP devoted their whole September issue to youth unwellness. And we amplified and accelerated not only our support programs, but our literacy programs. We scaled up a program called Ending the Silence. Silence in mental health is a killer. It's an absolute killer. Just like any other illness, somebody with a mental health condition who goes unrecognized and untreated progresses to much more devastating consequences. And Ending the Silence is a program for youth to identify their own unwellness or help a friend with theirs, facilitated by people with lived experience who remove the complete stigma of mental illness by telling their own stories. They're generally college students who are successfully navigating mental health crisis and living with it. And then we give them a resource card because, as you point out, with 211 and with JCFs and with Catholic Charities and with the strong managing entity system that we have here for the uninsured and underinsured, there are resources. People need to know that. We also brought in Ending the Silence for Families and translated NAMI National's only Spanish Ending the Silence for Families program, which is now being used nationally. It was translated into Spanish so that families know where to go and how to understand mental unwellness. And we brought in Ending the Silence for staff, because oftentimes the teacher, the day school agency folks, the staff, it could be the school bus driver, is the first one to understand that a child is not well. Children are not bad, they're not well. And when there's behavior, folks need to understand what those signs are and know where to get help as soon as possible. We also worked really hard on normalizing mental wellness and mental illness because we can't reach everybody with these programs. And we launched a very robust multimedia campaign with text messaging in zip codes that we felt were not demonstrating that the use of available services from the managing entity. We bought cell phone numbers and we texted them to connect them to services. 200,000, over 200,000 cell phone messages in those zip codes. We launched a TV and radio campaign. We brought in suicide prevention training to augment what you all at JCS are doing to reach the community that we tend to touch. All really important. Youth suicide, 20% of high school students surveyed by Pew said they were contemplating suicide. That is a really scary number, folks, and we need to work on that. We're thrilled to be working with the Y in bringing Ending the Silence. And on the normalization side, we launched the First Walk for Mental Health in person, virtual in 2021, in person in 2022, so that people could come out and see in the community that there are a lot of people. In fact, most of us, if we're being really honest, have had a mental health challenge at some point in our lives, and there's no reason to be silent about it. Right? And so all this lifted up the need for us to have conversations like this, that there are resources, that there's nothing to be ashamed of, that most of us will have a mental health challenge at some point in our lives. And let's be open and let's be okay about it. And so that really, the difficulties of the last few years really amplify the vision that we have for NAMI in the community as an educational resources as well as a support resource. And we hope that we're fulfilling that because the need is really great.
Yes, it is, and thank you for your impactful work. And
Thank you. We
giving
work
so
very
much
closely
of
with you.
yourself, you know, in terms of sharing the personal message and the professional work of your team at NAMI.
What people don't realize is that mental health, even serious mental illness, like the kind my son had, he was very ill, is treatable. And most people recover if they are caught early, if they have a support system like the one that we provide with peers, and if they stay on their treatment trajectory. It's treatable. People don't have to lose function in life. They don't have to become homeless. Disproportionate amount of homeless people are youth who are dealing with undiagnosed bipolar and paranoid mental illnesses. So anyway, that really gave us an opportunity to even do more.
And you have scaled
Thank you.
significantly. Thank you so much. And now to the resources for
Yes.
mental health care.
So thinking about adapting, our community, as Miriam, you mentioned, we've seen so much this past decade alone. And unfortunately, knowing this next 10 years, we're gonna see more unfortunate things unravel, whether it's in our local community, nationally, or even worldwide. And what do we do at Tulum? We're always ready to adapt. If we get hit by a hurricane, we never close. We always have people there available. The first month of the pandemic that we felt here, over 10,000 calls we were able to answer, people looking for resources for basic needs in the community. Whether it was Surfside, being able to have that support. People needed a confidentially, maybe they didn't feel comfortable speaking to the therapist there in person, but okay, what can I do with finding resources in my community? What options do I have? So we know that as humans, we're always going to feel scared, unsure, lost, where to go. We can't really predict what's going to happen tomorrow or next week, but by knowing that, where can I turn to for help? We're hearing just at this table alone, such impactful programs and organizations, but as Miriam mentioned, there are hundreds and thousands of different programs here in our community. There's no way we're going to remember every single program, but all right, can I go to 211miami.org and search some resources myself? Can I call up 211? Okay, I'm going through X, Y, and Z, can you help me? We're there ready to adapt no matter what type of crisis or situation we face as a community. I know we're always willing to come together, join one another, collaborate for the betterment of that person in the community that is feeling lost, that they don't know where to turn to next. And if we think of ourselves, whenever we've gone through something personally or had a loved one or family member go through something personally, we want to be able to either get help or help out others. So how do we do that? Educating ourselves with the vast resources in our community. I'm sure if we were to poll, downstairs random people, do you know where to go to, if you find yourself not being able to have food next week? Do you know where to go to, if your family member or loved one is having a mental health crisis, or maybe you're evicted, or maybe you have children that you want to see them flourish and how to get to them when they're young, or other programs for refugees or other individuals in our community that might be undocumented, scared, or they might be turn to. You're looking at it at this table, and it all starts with one number, 211. We can be that very first start to get you connected to the expertise that is available. And we are all nonprofits, so there is no cost. Things might be low income at a lower reduced cost, but we're really here to help. And I think I can speak for everyone at this table. We all have that passion, that drive. We're here for a reason, and that is to help out our community. So.
Thank you. Please.
And I think what I'm hearing is that, think the magical thing that happens between all of us is that we partner with each other.
Yes.
And we want to make sure that we have this like authentic community engagement. And we know that across Miami-Dade County, there are 1 in 3 households that are just one paycheck away, or one emergency, one disaster away from experiencing homelessness. And throughout the pandemic, and all the crises that have been going on, we decided that we needed to partner with Miami-Dade County, Access Helps, Miami Workers Center, Legal Services of Greater Miami, and SATLA to do door-to-door outreach and canvassing to raise awareness about what current resources exist. We were able to support residents in accessing emergency rental assistance programs, and also just making sure that people were aware of where to go and what to do. Many times we refer to you all to make sure that that the needs were met. And we were able to engage 30,000 residents, during this time. And so it's really, it was heartbreaking to hear all the different stories about food insecurity, housing insecurity, mental health, all the different issues. We were able to get in touch with many of our residents, and we were able to connect them to all the available resources. And I think that's what's pretty amazing to hear around the table, that we're all just making sure that we're here for the community and partnering with each other to make sure that one resident that sometimes is in someone's backyard in not the best housing situation, right? Or that one resident that is even on our streets. And I think it's pretty awesome to kind of see that all unfold here today.
Wow,
It's great work.
that is amazing. 30,000 reached. So that is pretty much, this is the work. This is the reason that we are all here with our unique missions that are unified by meeting people where they are, to address their needs in a variety of ways, and hopefully to be agile in doing so, whether we go to their homes or we're doing food distributions in mobile home parks and in alleys and driveways. It is how we reinvented ourselves in order to serve. And I hear that from every single agency that is represented here. And I know that beyond, there are so many nonprofit service providers and also governmental and private sector partners that are supporting the work that we do. And for that, we're very grateful. So now we're going to our third question, and that is, you all agreed to be here today, and you are part of our JCS family. Can you tell us a bit about the why in terms of speaking to the folks that are listening to the session this morning? Why reach out to 211 from your perspective? Why not give it a try, give an opportunity to reach in and see if we can provide a service to the community from your perspective, and food security and the why and justice issues? We'd love to hear through your lens.
So the why is, so first of all, a lot of times families come and the first thing that they're gonna look for is gonna be food. Not all the time, but many times that's the first thing that they wanna address. And then you dig deeper, and there are many other issues, and the issues are across this entire table and probably listening on the other side of that screen. The folks at 201 are prepared to ask those questions, to dig deeper, to understand, and really do a deeper assessment for the families. And if folks have, are raised by a grandparent, right? A child raised by a grandparent, then can we help that grandparent with medical supplies, with some of these other things? So there's a lot of things that go on behind the scenes that we as a food bank or our network of partner agencies may not know or may not ask. And so that's where 211 comes in to help really uncover a lot of these issues that our families face. We try to stabilize the household with food. But once you stabilize the household, then you can start addressing some of those other areas. You mentioned there are no bad kids. One of the things that we heard from some of the administrators at schools, because we have school pantries, is I thought there were good kids and I thought there were bad kids. Some of the kids are just hungry kids and some of them are well-fed kids, right? And so what our research with Aetna, one of the research projects we did in the school pantry was we found that behavior, attendance, and performance all went up when there was food in the household.
Absolutely.
A byproduct was the parents became more engaged in the child's education because they were having to go to school to get the food. So
Wow.
having those things behind the scenes, I think 211 can help uncover those and really help a family navigate the service waters, if you will.
Wow,
That's really great.
thank you. That really brings it home.
Yeah, I mean, how much more is there to add to that, right? But I think what's also been demonstrated in our conversation is the power of partnership. And we do not do all things for all people individually. And it's that network and training and understanding of how to do exactly what Paco said, which creates an ecosystem of support. And 211 is that backbone to that ecosystem of support. I don't think there is any other reason that every single one of us would want to show up on that list and say, let's make sure we're doing our part in that ecosystem of support. So it's hands down the first call for support and help in our community. We get messages and emails from all over. We handle about this much of what a person, each of us does. But collectively, we handle so much more. And that's through 211.
100%. Thank you very much.
You know, I think I'm gonna take a macro perspective, because I know on a micro perspective, you do wonderful work manning the phones in 211. But I think what the service is a reflection on us as a nation. Because if we cannot provide services to the most vulnerable in our country, being the wealthiest nation in the world, then that says something about us. And every person is sacred. Every person has human dignity. And I really think that's what 211 demonstrates to every, sure, you know, you're going to get help, but it's a way of saying everybody is important, whether it's that 16-year-old thinking about suicide, or that 35-year-old who lost their job, or whatever. And you know, we need that safety net, and that's what you guys provide.
We all do together. Thank you.
And I think it's also about trust. Trust, you know, there've been surveys that most Americans don't trust other people, and those numbers go up as income goes down. And I think 211 and its sibling 988, which is the mental health and suicide crisis line, that also you all so beautifully run and manage and are growing, can be viewed by the community as a trusted resource, that a well-trained person on the other end will listen and will be deliberate in helping people at their most vulnerable. And I always, from the mental health standpoint, encourage people, understand that this can happen to anyone. Have a plan. Because the worst time to deal with some of these challenges is when you're in the throes of the challenge. You know, understand what the resources are. You bring that all together, and I'm very excited about the future of the 988 piece, because that will take mental health and crisis response and suicide help to a whole new level in our community, and it's very, very much needed. So, you know, as a trusted resource for 211 and a trusted resource for mental health and suicide prevention, that's a very key role. And we're grateful that you're doing that, because it's going to change the face of our community, certainly from the lens of mental health.
Thank you, Susan, for your confidence. Please.
Yeah, hearing, your eloquent words, about 211. And just to add on to what you mentioned, we're only as good as our partners in the community in building that trust. It's a two-way street because we want to make sure that every single program that we have in our database are programs that have been vetted, that have these services available for our community. We want to make sure once we get that call, we know, all right, let's find out where you're at. Where are you at in the community? Okay, we found X amount of programs. Let's get you connected with these points of contact. So you can go ahead and be empowered to take that next step and go ahead and get connected. So, those who are listening in today, maybe you have a program or you're aware of a program that's going to be growing in our community. We want to know about it. We want to be that key place in our community where we're not needing to reinvent the wheel, creating X amount of databases. We're that one-stop shop, always ensuring that, following our accredited body standards of making sure that we have the most up-to-date information and making sure that we don't want to give people the runaround. We know how overwhelming that is for a person. If I need X, Y, and Z, I don't need to call 10, 20 different numbers to try to get that help. I should just be able to get connected to a couple of numbers and then have my needs met at that point. And then if for whatever reason they can't, all right, we have care coordination options to make sure that what can we do to ensure that connection is ultimately made and, get ready for the next thing. And building that awareness, I think is crucial. And I think here at JCS, we're very passionate about that. Going back to building the trust, we're out in the community. We're out physically in various neighborhoods throughout all of Miami-Dade County and being there present to have these conversations with the community to say, we're here today in Miami Gardens to talk about 211 and to talk about this service. Did you know about this? Oh, well, here's a flyer, here's a card you can call. Today we're here in Homestead. Today we're here in Alapata. We want to continue to be there and get this message out. And we really value, the support of everyone at this table and everyone listening in today to add to that dialogue, add to that very important, crucial communication piece. Because if we're just keeping this a secret to ourselves, how is that bettering our community? It's not. So we need to continue to have these types of conversations and not stop until every single person in our community knows what 211 is and knows that with that number we can get access to everyone you see here today and much more.
Great. Well, thank you, Richard. Please.
Thank you. So when I think about how awesome it is to partner with 211, I think about the families and youth that we've engaged. And each and every one of them said it was so easy to access 211, whether it was by phone, online, or even sometimes text messages. Because a lot of our youth, they're on a bus or they're traveling around, they're up to something, right? They're doing something and, they don't want to call someone. Sometimes they prefer to text or sometimes they prefer to be on the phone. And when we think about some of our families, sometimes some of our families may be in precarious situations. So they also may not be able to call. So they, access 211 via phone, via text or online as well. And just like what you said, you're just sort of this master database where some of the households that we've engaged, they've said 211 helped me connect to you. And then they also mentioned these resources. I'm like, perfect. Why are you calling me? It seems like you're already set. So we, I think that's what's so amazing about our partnership in trying to, provide that holistic wraparound support to each household that comes in through our doors or through our email or through our phone. And I think that's what, and engaging, when we think about equity, when we think about accessibility, I think that because of what you provide and what you do, we're able to tackle some of these systemic barriers sometimes. That unfortunately, sometimes our policies are not enough. So 211 is here to help fill in that gap.
Absolutely. Very good. Well, thank you very much. Well, I really appreciate this opportunity to share this hour with you. And I am so honored by the work that each and every one of you does on behalf of building strength and building a village that cares for one another in such a passionate way and also in such a smart way. And I just want to say to those that are listening out there, this panel discussion today on February 10th, right before 211 to 11 Day, is a tribute to our team at the Contact Center, who day in and day out, every hour of the day, are available for you in all languages to communicate, to connect, to be accessible, to be agile, and provide you the resources needed in order to uplift you and your families. Thank you so much for tuning in. Thank you to each and every one of our distinguished panelists. We really appreciate what you're doing. Thank you very much for building community with us.
Thank you.
Are there any questions at this point?
We do have one question on the housing affordability crisis. Panelists, could you please speak to why Miami is having a housing affordability crisis and how that's affecting our community?
Ooh, okay, so there are many reasons why, we're in this situation right now. If we take a wide lens to it, I think one of the biggest reasons why there's a lack of affordable housing are systemic issues. Unfortunately, a lot of the policies that were done in the past have led to where we are right now. To that point, our wages are just not keeping up. As I mentioned earlier, 1 in 3 households are making less than $35,000 a year. Technically, you should be able to afford at most $800 rent. I cannot find anything like that anywhere across the county, and so it's inequity. It's the low wages. It's the fact that I think we also know that due to inflation, there are a lot of issues. There's a lot of when it comes to property as well. Prices have gone up because of property insurance costs. And so unfortunately, this is just me speaking on the other side as to why sometimes people may raise their rent. Property insurance or mortgage may be going up astronomically. So to cover that cost, sometimes they raise their rent, which is, that's one issue. But again, I think there's not enough high paying jobs. And when there are, it's still not keeping up to what the market is currently providing. Also because of we're in South Florida, there are a lot of issues with disaster. A lot of times to preserve our homes and to keep our homes safe, it's quite expensive to be able to do that. So a lot of times, that's another reason why we're losing a lot of our affordable housing stock because we can't maintain it. And so homeowners saying, you know what, I'd rather move to this community because I can afford a brand new house here and I'm going to forget this house. Someone else comes in, they buy up that property and then they renovate it and then they rent it out at a really high rate, right? And those are some of the reasons why as to there's no affordable housing in Miami-Dade County, as well as there's not enough supply in general. We have a lot of underused land and we also have a lot of land that unfortunately we cannot use. Because we want to protect our environment. So it's I know that's not really an answer. So I'm sorry to whoever asked that question. But again, I think that there are a plethora of reasons as to why it's costs, it's not enough money, and it's unfortunately not the best policies.
Thank you, Audrey. So other questions from listeners in?
Yes, so we would like to speak about the taboo in therapy and accessing mental health care. So what will it take to have kind of a seismic shift in that taboo? How can we try to combat that?
That is very much a Susan Rachel question.
One of the ways that's a very stigma and taboo is still looms very large, is the biggest barrier to mental health care. And one of the ways to do that, and this has been proven in many areas, not just mental health, is that when individuals connect with other individuals that may have that may be different, they may have a mental health condition or may have a physical disability, and get to know them, it removes the stigma. And so the core essence of our Ending the Silence program is having a facilitator, generally a college student, who has had an eating disorder, may have had suicide ideation, maybe have a bipolar 1 or 2 diagnosis, maybe living with schizophrenia or some other psychotic illness, speak about the fact that, hello, I'm at I'm at FIU, I'm at Nova, I'm captain of the swim team, I'm majoring in political science, and I have bipolar disorder, and this is what it looked like when I was little, and this is how I got help, and I am living a wonderful, normal, functional, grateful life. And when the high school kids in particular and their families hear that, their eyes just open like saucers. And we actually do pre and post tests on dealing with that taboo and that stigma, asking particular questions. And the numbers from the pre-test to the post-test in terms of removal of stigma and willingness to seek help, two really important things, just go up astronomically. And that's why it's evidence based. And so having people tell their story, I tell my story, my son tells his story, will go very far in doing that. We're also reaching into Black communities. We've hired a Black community initiative coordinator to focus on faith communities that have a very, very important role in their communities in terms of normalizing the conversation. What will remove it is talking about it and not being ashamed. You're not broken. There's nothing to be ashamed of. I hope that helps.
Oh, it helps tremendously, and it's great to hear that it's evidence-based results and practice, because we're looking through metrics at the actual
Of
impact.
course.
And that's how we should be looking at all of the services that we provide. Thank you, Susan. Any other questions from the audience?
We do. We have time for one more
One more.
question. And on that note, Miriam and Richard, so the question is, what is the breakdown of 211 calls for needs? Like, what are the biggest needs that you have requests for?
So I think that's a great question. That's reflective of how we were strategic on building the folks that you have here today. Basic needs, whether it's coming down to house and food, you name it, these are the things that we're constantly seeing reflected in our data. Even before the pandemic, these still have been the top needs here in our community. Mental health. So this is something that, we're limited with certain resources that are in the community. So for example, when it comes to housing, we get a lot of people that are needing help with maybe rental deposit assistance or water bill payment assistance. So there's certain programs out there that there is a lack of funding out in the community for. But this is something where data is extremely important for us to be able to navigate and understand what these top needs are. And when people call in, we're able to get this information to better inform the community, to better inform our funders, to identify, okay, what could there be a new need that has not been present in the past 5 or 10 years that we're seeing bubble up because of these consequences of other issues that might be happening in our community. But yeah, this table here is a reflection of what
The priorities are, right? And so it's interesting because, we run our nonprofit agency based on information and data. Data informs decisions in terms of priorities, of investments and staff development and so on. And most recently, our metrics, the question is a great question and I'm so thankful for it. Our county government asks for that data when it's assembling its budget. I mean, that's impactful. That's where policy and investments in terms of tax revenue consider the information that's coming in from community, from those voices that call 211 and ask for help. And yes, rental and housing assistance, food assistance, economic assistance, just for basic needs as well as mental health are the priority areas. And with that, I am so grateful to the panel. I'm grateful for the listeners for investing your valuable time with us. We really appreciate it. All of the websites and contact information for the panelists will be provided for those that signed up to watch this session. Thank you so very much. And again, congratulations. And today we honor the 211 Contact Center team for their amazing work every single day, every hour of the day around the year. Thank you so much.